Master Kit. Master Kit product introduction. A stopper, tree fan drill, crystal drill, L stopper, lateral drill, guide drill, bone extruder, mount driver, slicing saw, aqua driver, bone drill, pineapple drill, torque wrench, sinus elevator, depth gauge. Instructions for using maxillary sinus internal lifting tool. Taking a bone height of 6 mm as an example. Assemble 4 mm R stopper with tree fan drill for fixed point bone extraction. Assemble 5 mm R stopper with crystal drill to further grind the bone. Replace with 6 mm R stopper to continue grinding the bone. Use depth gauge to check if the bone wall has been completely ground through. Replace with 7 mm R stopper to slightly grind off the remaining bone wall. After completely ground away the bone wall, use aqua driver for hydraulic lifting. Instructions for using maxillary sinus external lifting tool. Taking 2.5 mm bone wall as an example. Assemble 1 mm L stopper with lateral round drill and grind off the bone wall. Replace with 1.5 mm L stopper to further grind off the bone wall. Replace with 2 mm L stopper to continue grinding the bone wall. Replace with 2.5 mm L stopper and continue to grind away the remaining bone wall. Use the number 1 red sinus elevator to preliminary peel off the maxillary sinus membrane. Use the number 1 red sinus elevator to further peel off the maxillary sinus membrane. Use the number 2 yellow sinus elevator to peel off the maxillary sinus floor and contralateral maxillary sinus membrane. Use the number 3 blue sinus elevator to peel off the maxillary sinus membrane in the near, far, and middle directions. Implant bone powder. Maxillary sinus external elevation surgery completed. If no bone plate is reserved, use lateral reamer to grind the bone. Assemble 1 mm L stopper with lateral reamer for fixed point grinding bone. Replace with 1.5 mm L stopper to continue grinding the bone. Replace with 2 mm L stopper for further bone grinding. Replace with 2.5 mm L stopper to grind through the bone wall. Use side cutter to enlarge the window. After completion, use sinus elevator to peel off the maxillary sinus membrane. The usage method of bone extruder. Use a guide drill for positioning. Use the number 1 bone extruder for preliminary bone expansion. Use the number 2 bone extruder to continue expanding the bone. Use the number 3 bone extruder to further expand the bone. After completing bone expansion, implant the implant. Method of using bone splitting. Surgical manipulation. Prepare a hole with 2 mm initial drill to the correct depth at the planting site. Use slicing saw to horizontally cut along the alveolar ridge to the cancellous bone, and cut the cortical bone longitudinally. Use bone extruder to gradually open the bone plate and expand the alveolar bone. Implant the implant into the split gap. Screw in the sealing screw. Fill bone powder. Cover with absorbable biofilm. Autogenous bone collection method. Assemble the sleeve with bone drill. Extract the bone slowly with low-speed drilling at the bone extraction site. Remove the sleeve and collection completed.